Memedicine Cram Tachycardia Flashcard Set 15 Atrioventricular Reentrant Tachycardia AVRT. This deck of cards can be used for review for the National Council Licensure Examination. The healthcare provider is teaching a patient who has a diagnosis of Wolff-Parkinson-White syndrome how to manage an occasional occurrence of atrioventricular reentrant tachycardia, AVRT. Let's take a little detour. These are representations of the AV node, and this is how electric signals normally flow through and out, okay? Through and out. But in atrioventricular reentrant tachycardia, there's a loop. This is the orthodromic type, and this is the antidromic type. It's not bilateral. Where here, there's an offshoot and a loop. And so this is what a normal electrical impulse looks like. This is what the orthodromic type AVRT looks like on an EKG. And this is what the antidromic type AVRT looks like on an EKG. All right, that's just a little aside for review. So which of these maneuvers will the healthcare provider recommend? Select all that apply. Is it A, bearing down as if having a bowel movement? B, taking a brisk walk for a couple of blocks? C, breath holding for several seconds? D, applying firm bilateral carotid pressure. One more detour. The firm bilateral carotid pressure would ultimately act on the vagus nerve, pictured here. But the carotid portions is referring to the carotid arteries. And here is pictured the right common carotid artery. And here we have the left common carotid artery. All right? And last but not least, E, coughing vigorously. So I'll give you a moment to look over the diagrams and think about your maneuver selection. All right. Okay, so the patient would be instructed to perform maneuvers that stimulate the baroreceptors located near the aortic arch, shown here, and the carotid arteries. Okay. Although massage of one carotid artery is sometimes used, bilateral carotid massage is contraindicated in this instance because it may cause the patient to faint. Therefore, answer choice D is out. So some of the things that would be good would be coughing, bearing down, which is also known as the Valsalva maneuver. So that means answer choice E and answer choice A are in, and also breath holding are all vagal maneuvers that stimulate the vagus nerve and can slow conduction through the AV node. These are snippets of the AV node here, but here goes a better view of the atrioventricular node, okay? And interfere with the circular loop of AVRT, causing it to go back to normal and become this, all right? So again, the correct maneuvers would be coughing vigorously, bearing down as if having a bowel movement, and breath holding for several seconds. All attempts to stimulate the vagus nerve because it's a part of the parasympathetic system that triggers rest and relaxation and digestion. So that would it would cause like a bradycardia as opposed to a tachycardia. Okay. All right.